right, but don't worry. Okay. I'm going to go ahead and do it one more time to make sure your other eyes. Okay, perfect. So your pupils are equal, not reactive, just like we want to see. And then next, I'm going to have you, if you want, you can put your glasses back on. But I'm going to have you try and follow this light for me, okay? Okay, perfect. So next, I'm going to go ahead and check your mucous membrane. So I'm going to take this and stick it on your tongue so I can see back in your throat. Is that okay?
Yep.
Okay, go ahead and open for me, please. Okay, thank you. They look nice and pink and healthy. So next, I'm going to check for your facial symmetry. Can you go ahead and smile for me? Okay, and then can you raise your eyebrows? Okay, perfect. So can I go ahead and take a look at your hands and legs real quick? Okay, have nice, good color, warm, not moist, nice and dry. And then can I go ahead and take a look at your feet, please? If you want, you can go ahead and stick them up on my leg. Okay, perfect. And now can I check your nail beds?
Yep.
And cavity fill? Okay. Okay, good. Less than 2 seconds. Good. Okay, go ahead and stick your feet up here. Okay, perfect. So I'm gonna go ahead now and do hand hygiene again, just because I touched your feetsies. And so next I am going to take your, now is when I would take your vitals. So, yay. And so next I'm going to go ahead and auscultate your carotid, but before I do that, I'm going to go ahead and sanitize my stethoscope. Okay. Okay, and then I'm just going to make sure to do it one at a time. Okay, sounds good, no bruise. Okay, also sounds good, no bruise. So next I'm going to go ahead and take a listen to your heart and lungs. Is that okay?
Yep.
Okay. Can I ask you to scoot over just a little bit so I can sit next to you when I do this, okay? So the first point that I'm going to be listening to is your aorta, and it's on the right side at the second intercostal rib. So it's okay if my hands might be a little cold, okay? Okay. Okay, sounds good. Very regular and steady. Next, I'm going to listen to your pneumonic, and it's on the left side at the second intercostal rib. Across. Okay, sounds good. Very regular. And I'm going to go Herb's Point at the third. So sorry, it's just down a little. It's all good. Okay, and next I'm going to listen to tricuspid, which is at the fourth intercostal rib.
Okay.
Okay, and then sounds very good. And I'm going to listen to mitral, which is at fifth. So sorry, kind of getting down in here.
Okay.
Okay. Okay, so sounds good, all normal, which is what we like to hear. So now I'm going to go ahead and take your apical pulse for a little bit. Is that okay?
Yep.
Okay, kind of get up in your business a little bit, but
Solid.
so come down from the here. Okay. It was nice and strong and steady, and it was at 64. And then your respirations were 16, nice and even, steady, just like you want to hear. So now I'm going to go ahead and listen to your lungs, okay?
Okay.
So if you can take nice deep breaths for me. Okay. And then go ahead on the other side as well. Okay, I do hear a little bit of wheezing. Can I have you tune to your side so I can listen to your back? Okay. I'm gonna go. Sorry?
Okay.
Are you sure? Okay. Can you breathe in for me? Okay. One more time on the other side. Okay. I did hear a little bit of wheezing, and now I'm gonna take it on your lateral. So breathe in one more time for me. Okay. You can go ahead and sit back to normal. So I did hear a little bit of wheezing on both. So now can I go ahead and take your peripheral pulses?
Sure.
Okay. So I'm going to go ahead and take your radial ones. I'm going to just take off these hair ties, kind of get them out of the way a little bit. It's okay. You're okay. Okay, nice, even, strong. Take this arm too. Okay. Could you put one of your feet up here on my leg? Okay, so I'm going to take your also on the top of your foot, and then I'm going to go ahead and take it behind as well. Okay, good. Both pulses on this foot are nice, steady, even, good. Two, behind. Okay. So now we're gonna go ahead and check your range of motion and strength and everything. So if you could please repeat after me or follow what I do. So first we're gonna go ahead and bring our arms over, up top, get good, bring it back down, then up to the side. Okay. Can you bring them behind your head and then down to the lower of your back? Okay, good. Can you go ahead and put your arms out like this and just kind of move your wrist around, kind of turn your arms a bit, wiggle your fingers. Okay, looks good. And now I'm going to go ahead and check your lower range of motion. So at one leg at a time, could you please raise it up for me? Okay. And then if you could put your leg out and then bring it back in behind you. Okay. Do it for the other leg too. Okay, good. And then if you could stick your foot up and kind of push down like you're pushing on a gas pedal and then up. And then go ahead and do that with your other one. Okay. And if you could just go ahead and wiggle your big toes for me. Okay, so 5 out of 5 on your range of motion for both upper and lower, which is good, kind of to be expected for someone your age. So now I'm going to go ahead and test your strength. Is that okay?
Yeah.
Okay. So go ahead and stick your arms out for me. I'm going to push down, but don't let me, okay? So push up against me. Okay, good. And then if you could have your arm like this to the side, I want you to push in towards your belly, but don't let me push you out, okay? Okay, good. And now we're going to go the other way, so we're trying to push out. Okay, good. And then we're going to do this to the side too. So don't let me push in. Good. And then, okay, good. So now I'm going to go ahead and test your legs. So I want you to push up, and I'm going to try and push down, okay? Which leg do you want to do first?
I don't care.
Okay, we can do this one. Go ahead. Good. The other side. Good. I'm going to go ahead and test your hips. So I want you to push, try and rotate your leg out, and I'm going to keep you from doing that, okay? Okay, good. And now we're going to go the opposite way and try and turn it in. So turn it in like that, okay? Go ahead. Okay, good. I'm going to do this side as well. Good. And then against me. Good. And if you want to go ahead and put your leg up here, So I want you to push down like you're pushing on a gasket, okay? Okay, good. And then you can go ahead and do your other leg. Okay, go ahead and push down. Okay, so good. 5 out of 5.
Start by feeling your femoral pulses. Okay. And then I'm just going to feel your radial and your femoral together. They're equal and symmetrical. Next, I'm going to palpate the inguinal lymph nodes. Okay. Alright. And then just listen to your pulses. Next, I'm just going to feel for a pulse in your legs. Okay. So I'll have you bend your knees up. Feel the popliteal behind your knee. Right. And then just the posterior tibia behind your ankle. And the dorsalis beatus. Okay. Now, I'm going to put some pressure on the bottom of your legs to check for any pitting edema for about 5 seconds. Okay, no edema. Right, so now I'll have you sit up and we'll do your. First, we're going to start off by checking your sense of smell. So I'll have you close your eyes. We'll occlude one side of your nose and tell me what smell this is.
Peppermint.
Okay. Now you will occlude the other side. And this one.
Lemon.
Yep. Okay. Now I'm just gonna, you can open your eyes, touch your face, just let me know if you feel the sensation.
Yes.
Yes. Okay. I'm gonna have you clench your jaw and then open. Great. Now I'll have you close your eyes. We're gonna test your taste. And stick out your tongue, put your head back up. Tell me what you taste.
Peppermint.
Mm-hmm. Okay. You can open your eyes now. Have you raise your eyebrows. Okay. And puff out your cheeks. Great. And then next, I'll have you turn your head against pressure. Turn towards my hands. Yes, there. And then I'll have you shrug your shoulders. Okay. And now I'll have you stick out your tongue and move it side to side. All right. Good. So now we'll do some muscle movements. I'll put your hands on your thighs, one hand at a time. Flip your hand over. Okay. And the other hand. All right. I'll do the same thing with your feet. On my hand, tap your foot up and down. Okay. All right. This one, I will have you stick your arms out straight with your palms up. Close your eyes and hold that for 20 seconds. Okay. Next, I'm going to have you touch your nose with your index finger, arm out to the side, and I'll have you touch my finger and your nose. other arm. Okay. Now with that arm, you can do the same arm again. Finger to your nose. You're going to touch my finger. Your nose. Now close your eyes. Okay. And then same thing with the other arm. And close your eyes. Okay. And now I'm gonna do some sensory. We're gonna do a sharp and light touch. So first I'm gonna demonstrate on your palm, on your hands. This is gonna be a sharp touch, and this will be a light touch.
Okay.
So we'll do this on your arms, your trunk, and your legs. Start with your arms. I'll have you close your eyes. Okay. And let me know what you feel.
Sharp. Light. Sharp. Sharp. Light. Sharp.
Okay. I'm gonna do your legs.
Light. Sharp. Sharp. Light. Sharp. Light.
Okay. Now we'll do your chest.
Sharp. Light.
Okay. And now on your back, I'm going to have you lift your shirt a little. Same thing, eyes closed. Okay. Light. Sharp. Okay. Perfect. Alright. So now we'll do some sensations in your toes. So with your eyes closed again. Okay. Tell me which position I'm moving your toe.
Up. Down. Up.
Okay. Other foot.
Up. Down. Down.
Okay. Now I'm going to test, see if you feel vibration in your foot. If you can feel it, just let me know. Okay.
Yes.
Okay. Can you still feel it?
Mm-hmm.
Okay. Now the other foot.
Yes.
Can you still feel it?
Yes.
All right. Perfect.
2. 4.
Yes. All right. Now I'm going to place an object in your right hand and tell me what that object is.
Paperclip.
Yep. And with your left hand, another object.
Cotton ball.
Right arm. Have you relax your arm. Okay. And check the biceps. Great. Triceps. And brachioradialis. Relax your arm. And same thing on this side. Great.
So moving on to palpation. Any areas of tenderness?
No.
And no crepitus or any areas of bruising. Moving on to percussion. Resonance throughout. Dullness here. I'm going to have you inhale and then exhale. And then hold your exhale. So it's your diaphragmatic excursion is about 3 centimeters. I'm also going to do tactile ephemeris, so I'm going to have you say 99.
99.
Again.
99.
And again.
99.
So I can feel the vibrations neither increased or decreased. I'm also at your 10th rib. I'm going to have you take a deep breath and exhale. So adequate expansion about 2 centimeters. Next I'm going to auscultate.
Nice deep breath. Again. 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 And again. So using the latter technique, his respirations were vesicular throughout, soft with a low pitch. Next, I'm going to move on to the special techniques. I'm going to have you say 99 again.
99. 99. 99. 99.
Good. So on bronchoscopy, it's negative. It's dull and muffled. Next, I'm going to have you say EE for ergophony.
EE. 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 EE.
Good. So that was also negative. It was I heard EE throughout. Next, I'm going to do whispered pictorially. So I'm going to have you say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Good. So that was also negative. It was muffled and indistinct. So moving on to cardiac, I'm going to have you lay down. So your head of bed will be 30 degrees. So moving on to looking at the carotid artery and the jugular venous pressure. So I can see 2 small pulsations. The carotid is more regular and stronger, while the venous one has like 2 motions to it. So moving on to palpation. Nope, see, just like that. It's a 2+ for the carotid. Strong and brisk. I'm going to auscultate it next, so I'm going to have you hold your breath. Good. So when I palpated, I did not feel a thrill, and when I listened, I did not hear a bruit. Next, what I'm going to do is palpate the anterior chest. I don't feel any heaves or thrills. I do feel a pacemaker up here. Any tenderness?
No.
Good. Next, what I'm going to do is listen. I'm going to auscultate the different area. Well, I'm going to actually start with the point of maximal impulse. So I wasn't able to see it, but palpating, I can feel it right here. It's about 2.5 centimeters in diameter, brisk, and feels just like a small tap. Auscultating the different points. On the right side, on the second intercostal space, is the aortic. S2 is longer than S1. The second intercostal space to the left is the pulmonic. The third intercostal space, which is Erb's point, S1 and S2 are equal. The fourth intercostal space is the mitral, and the fifth intercostal space, midclavicular, is the apex. Which S1 is greater than S2. Moving on to the peripheral vascular system, the radial pulse, 2+, the brachial pulse, is 2+ as well. I'm going to feel for the epitrocular lymph nodes, which I'm unable to palpate. Next, I'm going to perform the Allen test. So I'm going to have you make a fist, occluding both the radial and ulnar pulses. I'm going to have you open your hand, in which case it's pallor. I'm going to release the ulnar artery, and it pinks up within 3 seconds. So that's normal. Next, what I'm going to do is palpate your axillary lymph nodes. I'm going to have you move that out. Any tenderness?
No.
Non-palpable, which is a normal finding. Next, I'm going to check for aorta. which there's no pulsatile mask. I'm having some difficulty seeing it visually, but that's not unexpected. But it does not appear to have a pulsatile mass, which is an indicator of an abdominal aortic aneurysm. Next, what I'm going to do is palpate your inguinal lymph nodes, which are non-palpable and normal finding. Moving on to inspect the legs. So he has his legs are an appropriate color for his ethnicity. He does have some hair loss, but there's no obvious venous changes, no obvious discoloration or pigmentation, ulcers or anything like that. They're warm and dry to the touch. Next, I'm going to palpate his femoral and popliteal, dorsalis, and posterior tibial pulses. So starting with the femoral, +2, +2, +2, and +2. Next, I'm going to check for edema. And any tenderness when I do that?
No.
So he has all normal findings.